exists everywhere and can affect anybody. It is an infectious airborne disease caused by Mycobacterium tuberculosis. Most often it affects lungs. It can also affect spine, joints, lymph nodes and brain.
Do you know that in 2015 over 10 million people developed TB worldwide? In India alone, about 36 lakh cases were diagnosed and around 4,80,000 people have died because of TB.
So who gets tuberculosis and what are the symptoms of tuberculosis? Now, people who have had a loss of weight, loss of appetite, malnourishment, fever, sweating at night, chills, and people who have a cough that is not going away for more than graduated for tuberculosis, especially in a country like India where it is so common. What are the risk factors for getting tuberculosis? Anybody who has diabetes is definitely at risk of TB. It's also important that it is critical for life-saving in these patients. It is also important to recognize that people who have low immunity, people on steroids, people on special tuberculosis should be evaluated urgently if they have any symptoms which we mentioned earlier.
When it comes to the diagnosis, like all blood tests, the only sample that can be tested, this sample can be tested for AFB smear, gene mutations for a minimum of 6 months. So development of drug resistance. If the medications including injections, this is a very complicated treatment associated with more side effects. So it is advisable to take the medications properly in the first place so as to prevent development of drug resistance.
TB is preventable and can be treated at a very low cost. It is notably important